Hello and welcome to Caregivers First. This is a show brought to you by SCAN, the Social Communities Activities Network. We're located in the lower level of Monmouth Mall, and I have two guests today that I'm going to introduce you to. I'm your host, Tracy Wolfman. I am one of the board members here at SCAN in the Monmouth Mall lower level. On today's show, we are going to be talking to Mr. Paul Longo and Dr. Sara Ali. Welcome.
Pleasure to be here.
Both of them are from the PACE program, which is all-inclusive care for the elderly.
Right.
So just to tell us a little bit, Paul, I'm going to tell people about you first. You're a social worker for 30 years, mostly in Monmouth County, supervisor of the social workers at Beacon of Life PACE program. And you have tons of experience.
I do.
Housing, homelessness, higher education, and of course working with the geriatric population. Dr. Sara Ali is a board-certified internal medicine geriatric physician, right? Practicing medicine for the last 10 years and currently working as medical director for Beacon of Life. Her special interests are in managing complex geriatric syndromes, including cognitive impairment, geriatric psychiatry, and fall prevention. So for all of our viewers out there in the community, I again would like to welcome Mr. Paul Longo and Dr. Sara Ali from Beacon of Life PACE, All-Inclusive Care for the Elderly. So welcome to the show today.
Welcome, Tracy. Thanks for having us.
Thank you for coming. So why don't you tell us a little bit about what Beacon of Life is all about?
Okay, so I'll start with what a PACE program is, because PACE is really a type of program. We are one of many. There's about 150 nationwide. There's 6 in New Jersey. We're the Monmouth County PACE program. Atlantic and Mercer and other Hudson have programs as well. PACE stands for a program of all-inclusive care for the elderly, as you've mentioned, and all PACE programs have the same goal. All 150 programs are focused on keeping more fragile or frail elderly safe and living at home outside of institutional care settings.
Right.
And when we use that language, what we're really talking about are obviously nursing homes, but also reducing hospital time, reducing hospital stays, hospital visits.
Which is the biggest goal right now for all involved.
Right. Right, and PACE is an innovative way to do that.
Now, let's just back up a minute and tell, so where are you located?
We have actually repurposed the old Patterson Hospital on Fort Monmouth. We are literally on the
great location.
We are on the old part of the fort. It's fabulous. We see a lot of people come through our doors who say, I was born here, I worked here.
That is amazing.
It's a great experience, and it's a beautiful facility. Well, you've been.
Yes, I have been there. It's a beautiful facility. So you're located at Fort Monmouth on the former grounds in Eatontown, but the entrance really is
it's the Oceanport side.
Oceanport side. Yes, I like that easy in and out over there.
Yep.
So how did the PACE program get started? Because you've been open now about 3 years?
Yes.
And I didn't realize there were so many other programs across the state of New Jersey, but is it only in New Jersey?
It isn't. PACE started in San Francisco in a community that really was resistant to institutionalizing their elderly.
Okay.
And a dentist and a social worker and a nurse kind of got together and band-aided an idea together to really provide nursing home level of care out in the home and in the community. It worked really well. They made another one on purpose. The original is called Unlock, I believe, and is still in San Francisco. And those of us who work in PACE who go to San Francisco, of course, visit. And they're used to it. They're used to having PACE people come and visit them. So changes in how Medicaid rules work have somewhat governed in reimbursement rates and stuff like that, the development of PACE programs. They sprung up quite a bit. There's a lot in California. And then not too far back, it became attractive again under the Medicaid rules. And you're seeing another wave of PACE program development. We're in kind of a second wave.
Okay, so you got the second wave.
We got it.
And you brought it, thankfully, to Monmouth County for those viewers that are watching in Monmouth County, and it's easily accessible. What are the requirements to become eligible to be a PACE participant, do we call them?
Yep, participant, we call them. You have to be 55 or older. You have to need some help staying safe in the community, which we can provide. You need to be in our service area, so we only serve Monmouth County, although we have received approval from the state to develop a program in Ocean County as well.
Okay, and we have viewers in Ocean County because SCAN is now in Ocean County, so that's a good thing.
Congratulations. Congratulations.
Thank you.
So we are currently in the process of developing that program. It's not an idea, it's actually being made.
Wonderful.
So
So right now you're covering Monmouth County.
Correct.
Okay.
Yes, all zip codes in Monmouth County.
All right. So the requirements for eligibility.
Right. That's 55 and over, needing some help to stay in the community and being in our service area, really. And when we talk about needing some help, PACE brings an army of support services to try and keep people safe in the community. We have our own home health care division. We have our own transportation. We have our own vans, buses. We have social work. We have physical and occupational therapy on site. We have our own ambulatory care clinic on site. We have a medical director who runs that ambulatory care clinic.
Yes, and I'm looking forward to hearing about that also.
So we take all of those things and come up with what we call a plan of care, which we put into place that we are confident can keep somebody safe at home for as long as possible.
So the goal is, just to reiterate to our audience, is that you're going to take on their care, you're going to provide all the services, keep it under one roof so they can stay in their homes, and they have lots of oversight, lots of support, and guidance, I would say. Let's have a typical day in the life of somebody who is a member of the PACE program.
Okay, I'll give you an idea of somebody who's perhaps having more trouble than most staying in the community.
Right.
And
that would be due to ailments, illnesses,
cognition, right, fall risk. So not uncommon to be, knock on the door early in the morning from a home health aide who's going to help you get dressed and ready and showered and cleaned up and ready to go. The van they would help you onto the van.
Nice.
The van's going to bring you to the center where you're received by the recreation staff, but also I think it's important to know that if transportation or recreation or anywhere along this path, your home health aide sees a new sniffle or a new wobble or something different or concerning, they're going to tell a nurse. And if needed, they're going to take you down to our triage room and take a look at you just to make sure everything is okay. We're very prevention focused.
That is wonderful.
Right. And then of course, if needed, they're going to march you down to see your doctor.
Okay.
So otherwise, more typically, you're going to go and have breakfast. We offer breakfast and lunch, hot lunch every day. We have full recreational program. We have bingo. We have games. We have crafts, and everyone's different. Some folks will come in and meet up with their friends and play cards.
Everyone's different.
Everyone's different. So everybody's day from that point is going to look a little different depending on what the activities are. But we do bring in a lot of live entertainment, which is very popular, as you know.
It's very popular.
As you know. So the days, if we're doing Cinco de, we're focused on whatever the time of year, whatever the theme is. We're always having some kind of themed entertainment.
So for those, that's a great all-inclusive day. They're picked up, they're fed, they're they have oversight. But what about your person who maybe is a little more independent, and they don't want to come every day?
Right.
So let's talk about them.
Absolutely. Our participants come anywhere from no days to 5 days.
Okay.
So we have some folks we call PACE at home. They want the comprehensive medical oversight. They want access to the services. They want the easy pharmaceutical program that we offer.
Correct. And affordable.
Right. There's no cost to any of our participants, and I'm happy to cover as much of that as you want, but our participants pay nothing out of pocket. So some folks, they are content at home where they have a social life in their buildings or community.
Right.
And some folks really need that extra socialization, or perhaps they're cognitively impaired, and we would like them to be there more so that we have more eyes on. So it really does vary. I'd say the average is about 3 days a week for our participants.
Right, so they're getting a little taste of it, they're getting the oversight, and you get to keep a closer eye on them, because the goal is to keep them out of the hospital.
Right.
So if we have oversight for this population, which we've all been working in, right? Then we can stop the problem or the disaster or the hospital emergency room visit from occurring.
We're very focused on breaking the cycle of fall or illness, emergency room, admission, rehab, home, let's do it again.
Right.
We're very focused on breaking that cycle and keeping people at home. We have folks in our program who used to be regulars in the local hospitals who haven't had a hospital visit in months and months and months because they have that access.
That is wonderful.
That care. PACE, there is no program where you will get better access to health care than PACE.
That is wonderful. The whole object, though, and I don't think people, unless they've gone through that cycle, and it is a constant cycle, it's ER, hospital, rehab stay.
Right.
They become more confused and they have more difficulty trying to come back from that.
Right.
So
Every time, right, right.
every single time. So PACE, all-inclusive care for the elderly, so our viewers can remember now, located on the grounds of Fort Monmouth with an entrance on the Oceanport side.
Yep.
Open 7 days a week.
5.
5 days a week.
We do have a 24-hour, 365-day on-call service for healthcare needs of our participants as well.
Our nurse is on first call, doctors are on the second call, so we are approachable 24/7.
So-
And if we have a need to go to see a patient during the weekend, a nurse can do a visit and the doctor can also go in.
So if
do
they're
home
having a
visits.
problem on the
Yes.
weekend, they can be seen.
Absolutely.
Oh yeah, absolutely. And if they do have an emergency or require a hospitalization, they're followed by their doctor who knows them every day right into the hospital.
Right.
That is wonderful.
So
We have very good established relationship with the local hospitals. So we communicate with the hospital that a patient is on their way, we're going to be there,
And
so we
give them their
collaborate.
history,
Yes.
their medications, and everything that goes along with that.
Right.
The nice thing about that, though, is that you can typically know everything about that person, and if they're going to transition into the hospital for a sudden onset that you weren't expecting, whether it be a fall or some kind of illness.
the other thing that's important is with the army of services that we have, we can get you out of the hospital much faster.
I'm sure you
We
can.
really will shorten your stays. In fact, PACE is a rather well-studied model, and we're going to reduce the amount of time our participants spend in institutional care settings by 85%.
That is a fabulous
So,
statistic.
so you're home.
Right.
You're home.
And also, they have better management post.
Yep.
Because a lot of
Yes.
times when families, they don't realize that they're coming home and they're going to need a little more supervision and assistance than they did.
Our participants who are hospitalized see their primary care doctor as they leave the hospital on every discharge.
Which is a fabulous thing.
Right.
You know, people don't realize where things fall through the cracks.
Right.
Recently, one of my employees actually had a family member post-op from open heart 9 days before a nurse got out to the house to check his dressing. So, you know, when we talk about our population, you know, I know we're all very protective. We've been in
We
this
are.
field a long time.
Yes,
We're protective,
we are.
and we want to make sure that they have the best services available to them.
We discharge from the hospital to our own ambulatory care clinic.
That's
Right. We start actually talking about the discharge the day of admission, so
Right.
that we have all plan in place upon the day of discharge. If we need to set up some home care, we're not wasting a day
not
to set
wasting
up
a
home
day
care.
because you have all of the
Yes.
resources at your fingertips.
Absolutely.
Okay, so we are having a conversation here with Paul Longo, Director of Social Services at the PACE program, and Dr. Sara Ali, who is the Medical Director at PACE, located in Tinton Falls on the Oceanport, rather.
Oceanport.
Sorry, my apologies. On the grounds of Fort Monmouth. And when we come back, we're going to hear from Dr. Sara Ali on her role in the community and how she keeps everyone healthy and happy and staying out of the hospital.
Of course.
Very good.
Thank you.
So we're just.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to Caregivers First, the show brought to you by SCAN, the Social Communities Activities Network. I am your host, Tracy Wolfman, and I'm also a board member here at SCAN. We have two lovely guests here today. Is Paul Longo, who is the Director of Social Services at the PACE program, and Dr. Ali, Sara Ali. My apologies. So, Dr. Ali, we've gone over what PACE is, where you're located, and why don't you tell us a little bit about medical conditions that you treat at PACE so our audience can know that they don't have to necessarily be sick or ill to join the PACE program.
Right. We treat we see and manage and treat all medical conditions at our clinic. We are more focused on the geriatric care, so we treat all geriatric syndromes there. We treat extensive wound care. We do have comprehensive history and physical exams, which are required by CMS guidelines. Those are done every 6 months.
Right.
We have sick visits.
So the CMS guidelines, so the audience probably wouldn't know, but what you're doing is a comprehensive evaluation, assessing them so you have a baseline of
Yes.
their health, and then you can treat them moving forward.
Yes, starting with preventive care.
Preventive care, number one.
Yes. So preventive care, we discuss goals of care, what are their wishes in life, how aggressive they would like to be treated. And based on their goals and wishes, we come up with a care plan and we treat them accordingly.
Wonderful. Now, if somebody has, like, I know you're doing diabetes management, medication management. Yes. I mean, there's a lot of things that are, it's such a broad area that we're focusing on. But they get to come in and see you, and you and your team will evaluate them, put this plan into place, and then how often do they get to see you or one of your staff?
If everything is fine, we may see them every 6 months, which usually doesn't happen as much. We do see them for sick visits in between. We can see them for same-day appointments. If we make a medication change, we may see them in a couple weeks. So they are seen on as-needed basis in between post-hospital follow-ups, after surgery, before surgery, so they're seen all the time. But the 6 monthlies are mandatory visits which we have to do. Those are comprehensive and preventive care visits.
Correct. So when somebody's going to have a pacemaker put in, or they're going in for cardiac surgery,
yes,
they can know that they can count on you to do that evaluation for them before they go, and also to follow them when they come out.
Absolutely. All those arrangements are also made by the clinic. So we schedule them.
So you take care of everything.
Yes.
We drive them.
One-stop shopping, you drive them. Fabulous. Dr. Ali, why don't you tell us a little bit about the staff that works with you in that clinic?
So I'm the medical director, and I have 2 advanced care nurse practitioners. We work in collaboration. They have great geriatric experience. We have 2 registered nurses who do nursing appointments, and they do wound care especially, and manage medications with our patients.
Okay.
We do have other ancillary staff, front desk, secretary, and pharmacy tech on
Pharmacy
site.
tech, that's an important job.
Absolutely.
We always forget about the pharmacy tech who needs to manage all our medications, because there's new ones coming out every day, right? So one of the things that I think people are always uncertain of, they've been going to the same doctor for 30 years.
Yes.
With insurance changing, I think people are much more adaptable now, and it does happen, but can they still see their own doctor if they so choose?
Absolutely.
Okay.
So we totally understand that patients have established relationship with their doctors. They've been seeing them for so many years. They really trust their primary care doctor. They really want to see the same cardiologist. They have a lot of trust in them.
Right.
So they can continue seeing their outside doctors out of PACE network, and we can collaborate their care along with them.
And communicate with them.
And still
provide all the oversight.
Absolutely.
I'm sure that communication between the two would be a great asset to both the patient and to your staff too.
Always. We always want to communicate with their primary care doctors before enrollment also, so we know their baseline better.
Right.
And if they would love to continue with them, that's always an option.
And what about if they have to, say, be referred out to see a specialist, maybe a cardiologist, endocrinologist, something of that sort?
Again, if there's a need to see a cardiologist, we will see them at the clinic. We make that medical determination, and whatever services they're needing, whatever specialists they need to be seen, those appointments will be made at the clinic, and we'll provide transport. We'll send them to the appointment and follow up after the appointment. Make sure what the recommendations are made are being followed, and make the appropriate changes in the medication, schedule for the appropriate procedures recommended. So we follow through.
Oh, I'm sure. So that's part of the whole advantage of the PACE program, is to have that follow
through. All appointments are made. All specialist appointments are available on as-needed basis.
So they can see their specialist, and you can set that all up for them.
Yes.
What, and I think, Paul, you had already spoken about this, the cost to join the PACE program.
Right. So PACE programs, all of us, are little, very tiny managed care organizations. So we will take over as the insurance as well. Our typical participants are dually eligible, Medicaid and Medicare.
Okay.
You can enroll with just Medicare, but most of our folks are dually eligible, Medicare, Medicaid. So we become the insurer as well, and that's how the cost is covered for our participants.
So once they sign up with the PACE program under Medicare and Medicaid,
yes,
all of their services are covered under that.
Correct. Medicare and Medicaid pay us to take care of them.
They don't have to worry about that.
They don't have to worry about that. And in many cases, for folks who are on a fixed income, their net monthly Social Security will actually be a little higher, because the Medicare Part D will be put back in their check. So that $60 or $100 will go back in their Social Security check, because we are also their pharmacy, and we're going to provide the Medicare Part D drugs that they need. So
they can get all their prescriptions filled on site at your clinic.
The prescriptions are the medications are usually sent to their house, or they're sent to the clinic. We administer medications to our participants who are not able to take medications. We help them. We set reminders for our patients who have trouble remembering when to take their medications. Okay. So we have a whole process in place for medication compliance.
And SCAN is having their technology fair down in Ocean County in August. And they just said they're developing, and I don't know if you heard about the pillow mechanism that's dispensing the medications for them. So I said I want to go to the technology fair to hear all about this, because all of us may be using it. It's not just one particular program. But probably for your people, they can take their medications they're already independently taking their medications, and if not, your staff will dispense them.
Right. Well, we get all kinds of patients. Sometimes we get patients who are supposed to take medication, but they're not taking medication. They didn't get the appropriate medical care they deserve. So we start them on medications, and then we see they're not able to, so we administer them medications in our facility.
And I'm sure a big component of all of this, as we know, it has to be the education piece.
Yes.
To educate them and to explain the necessity of having good quality regimented medication.
And Dr. Ali is actually in the day center regularly doing presentations on managing your diabetes, on managing your medication,
medications and
heart care.
Yeah.
So you're seeing the clients, you're managing the clients, you're overseeing the whole clinic, and you're doing education for them.
Yes.
That's wonderful.
I
guess that's a nice little mix of your day. So it's not the same thing all day, every day.
You're right.
You mix it up,
yes.
Right? I think I read someplace you're an educator too, with the clients.
Yes, so I have taught medical students, I have taught nursing students, and I love to teach, and I love to do presentations for my participants. So we do have a monthly series where we talk about current pressing issues, healthcare issues. We have done a very interesting presentation on polypharmacy recently.
Oh.
Our participants really...
Polypharmacy, just so our audience or our viewers knows what polypharmacy is, a multitude of medications.
Yes.
You can explain it better.
Taking multiple medications which may not be necessary at this time, and avoiding those drug interactions, those side effects, and potential problems. So appropriate medication management and avoiding polypharmacy is so important. And it becomes very easy for us to do that because there's only one prescription pad.
Right.
We are not, all the consultants who are making recommendations, they all come to us. So when we review it, we know our patient is taking these many medications. We can easily...
You know what's going on, because they're not
Right.
going to various multitude of doctors who are each prescribing different medications.
It does happen that the
Oh, it happens
cardiologist
all
may
the
not be
time.
aware of the orthopedic recommendations. The orthopedic is not aware of the rheumatologist recommendations. We are aware, and we manage the medications based on the patient's medical profile.
And you know exactly what they're on because you're
Yes.
dispensing the
We're
medications.
dispensing the medications.
Then you even have better oversight.
And that-
Where physicians out in the community are not dispensing the medications, they're writing prescriptions. But how many other doctors are giving out prescriptions to the same person? So.
And it works with, it also works it's an important part of our prevention focus because it prevents falls and illnesses and side effects that could, again, lead to that cycle of emergency room visit,
And it's a cycle.
right, admission, rehab, home.
And, nobody would really have the wherewithal to look up every single medication they're on
Yes.
to find out which ones are going to interact with the other one because there's unless you have a database from like the medical doctor who knows that.
Yes.
So I think that's where a lot of problems do arise with this population, and it's always wonderful when somebody could really manage the medications. So you have a double protection for your clients that are seeing you there at the PACE program. How can a person contact you to become a member or a participant or a patient, however you're going to say it?
732-592-3400.
Oh, tell our audience that again.
732-542-592-3400, and you can ask for admissions or
Right.
enrollment.
And they can get an explanation, they can have a visit to the
Absolutely.
program.
Yes.
And
We call it a day in a life.
Right.
If when they would like to come and spend a day with us, they come and spend a day with us, they see how we are, and if they're still interested, they can start the enrollment process.
they can start. Well, I want to thank both of you for coming on our show today and educating our viewers here at Caregivers First. Caregivers First is a show to provide viewers with resources that are in the community and to give them quality services. So thank you for joining us on Caregivers First. I am here today with Paul Longo, who is the Director of Social Services at the Beacon of Life PACE program, and Dr. Sara Ali from Beacon of Life, who is the Medical Director. Correct?
Pleasure.
And we will encourage anybody, if they want to stop in for a visit or a tour of your
Yep.
program,
Sure.
you're available to do that. And just to get a view of what's going on over there and if that's a program that is going to be beneficial for you to have comprehensive care. So